north of 60. I'm Heidi Schweighofer. I have two interesting guests with me today. The first guest is Karen Elliott, who is the program director of the Alzheimer's Association of Greater East Ohio. I also have with me Leslie Knoblauch, who is the outreach coordinator for the Take Me Home program of the Summit County Prosecutor's Office, and I invited both of them here together because I've recently learned that their programs in many ways complement each other. Thank you both for coming.
Thank you for having me.
Thank you.
Karen, I had an experience this year that I have never had before.
Mm-hmm.
I turned 65. I had my annual physical.
Mm-hmm.
And the very first thing that happened when I went in for my exam was that I was given two cognitive tests. One was putting numbers on a clock,
Mm-hmm.
and the second one was remembering three items and then having to recite them a little
Mm-hmm.
bit later. And I had never had that happen
Mm-hmm.
to me before, and I didn't know if it was because the doctor thought that I needed the test or whether it was just something that is now routinely done. Can you talk a little bit about the testing and what's going on in the doctor's office first?
Sure. As part of your Medicare annual wellness visit, a cognitive assessment is part of that visit. So now that you are of age to have Medicare, you are entitled to that Medicare wellness visit. And so a cognitive assessment is part of that. The interesting thing is you're not alone. While many seniors know that the annual wellness visit is a benefit to them, they are not aware that the cognitive assessment is part of that protocol.
And I go with my father, who's in his 90s, to the doctor.
Mm-hmm.
I cannot say he has ever had the test.
Mm-hmm.
Is it showing early symptoms? Is it something that is of benefit to everybody at 65 and over?
Absolutely. So about 82% of seniors feel that having their memory and thinking tested is important, but about 16% of those folks say that they are receiving regular cognitive assessments from their physician. There seems to be a little bit of a disconnect where physicians are waiting for the older adult person to share their concerns about memory loss, and the older adult is kind of waiting for the physician to initiate a conversation about it and to do the assessment. The great thing is the majority of physicians do feel, almost 100% of the physicians do feel that it is important to test memory and thinking as we age. However, only about 50% of the physicians have that as a regular part of their protocol at this time.
Is it lack of education or just a not awareness of the need to do it and why it should be done?
I think there is a little bit of a disconnect between the expectations. I think if most doctors, what we know, if a family member does express, like you do, that your father is having memory problems, they will absolutely do some memory testing. The older adults themselves are it's very uncommon for them to want to address that memory issue within the doctor's setting.
It's embarrassing. I know that my dad has done everything he can not to want to admit that his short-term memory is not what it used to be and that there are some memory deficits that are occurring.
Sure. So what our research finds is older adults have a few reasons why they're probably not approaching that. Number one would be fear that maybe they do have Alzheimer's disease. Another reason is that they feel those memory tests and the cognitive tests that we have may not be a good indicator or may not be the best to prove whether or not there are memory issues happening. So looking at those two factors alone, we could probably see why perhaps we're not hearing the older adult person addressing that concern. So
I don't have a lot of knowledge about this. I'll be very honest.
Sure.
When I hear Alzheimer's and then when I hear the word dementia, I think that they are two different things. And maybe they are. And I don't think I understand the difference
Sure.
between the two?
It's a great question, and it's one that is misunderstood by a lot of people. It's a question that a lot of people have, and something we address in most every education that we do provide. So dementia is actually a set of symptoms or a syndrome. So it's what you see. It's the problems with thinking and memory and perception that you see in a person. So if you have a dementia diagnosis, what you should really be asking is, well, why? So what are the reasons that I'm seeing these symptoms? Alzheimer's disease is the most common reason that people have dementia symptoms, but you can have dementia symptoms for a lot of different reasons, which is why it's so important to get a thorough evaluation if you feel you're having memory problems. Anything from vitamin deficiencies to hypothyroidism to sometimes even depression can mimic dementia symptoms and can be reversed if we have the right treatment. So very important to talk to your doctor and ask him to take a look at your concerns.
When I used to be in the hospital as a nurse, I know that sometimes after surgery, patients would have dementia symptoms, I guess. So it was short-term and circumstantial.
Sure. Yep, perfect example of something that we can fix.
Yeah.
That would eventually, I imagine you would see their cognition returning to normal after a period of time. Absolutely.
When I go to make a phone call and I suddenly can't remember who I was going to call, or I leave my reading glasses, of which I have at least 50 pairs all over the house, and I can't find my reading glasses, I think to myself, oh, I'm 65, oh my gosh, I'm getting Alzheimer's disease.
No worries. So the problem would be if you went to make a phone call and you could never remember it later. You know, that would be a little more concerning, but typically you probably will remember later who you set out to call. We all go to the basement for something and forget why we went there.
Yes.
We all lose our glasses. As long as you're able to retrace your steps and go back and find what you were looking for, or retrace your steps and get the thought as to why you went to the basement or where you left your glasses, then there's usually nothing to be concerned about. But always, if you do really are worried about it or have some concerns, it's always the best scenario to make an appointment and see your doctor. But all of what you're describing to me sounds very normal.
Good.
Memory loss that we all have, irregardless of age, right?
Thank you.
Yes.
Thank you. Is the incidence of Alzheimer's disease increasing, decreasing? Do they know? And let's talk a little bit about what can be done. So.
Sure.
And oh gosh, I have so many questions. Yes. Go ahead, answer those first.
Yes,
all right.
Yes. We are now at 5 million Americans who have the disease.
Oh my word.
Of those 5.8 million Americans, about 200,000 of them are what we would call early onset or young onset, which would mean before the age of 65. And as we age, of course, our risk increases. And so after age 65, your risk is going to increase by double, essentially. If we're not finding anything that can slow down the rate of this disease or a cure, we're going to have about 7.2 million Americans between now and 2025. So in almost a little bit less than 6 years, we'll be looking at 7.2 million Americans with the disease.
Oh my gosh.
And so what does that mean? Does that mean more long-term care facilities? Does it mean more home health?
Sure.
What is the impact on our health system?
Yes, definitely. So when we look at care for folks with Alzheimer's disease, and we look at the burden on the caregivers and the financial impact of that, I think the important thing to remember is the caregiver, the care partner in the situation. So of the folks that are being cared for by a loved one, about 83% of our seniors are being cared for by a loved one, irregardless of dementia diagnosis or not.
You mean here in Hudson or nationwide?
Nationwide.
Wow.
And so of those, there's about, of those 83%, more than half of those family members are caring for someone with Alzheimer's disease. And there's the toll is both physical, emotional, of course, and financial. So the majority of the financial burden falls to the family, but also to Medicaid or Medicaid and Medicare system.
So they're paying for, there's no cure, so they're paying for perhaps additional home health aides to come in, or caregivers.
Sure.
Is there we talked about the medicines that we see advertised on television. Are they helpful? Are they slowing things down? Are they expensive? Do you know anything about those?
Sure. So we have 5 FDA-approved treatments for Alzheimer's disease. And while we don't have a cure, we don't have a prevention, we really don't have a treatment that slows the progression of the disease. What the medications can do is make conditions a little bit better in your brain for your brain to work. So it keeps the levels of an important chemical messenger that's used for learning and memory higher than they would normally be. So all the good brain cells can talk to one another a little bit better. So hopefully that result of that is a person who's independent a little bit longer.
It's very sad to me. I imagine the life of both the Alzheimer's patient and the caregiver cannot be pleasant. I feel sorry for the caregivers. I think that they need respite. They need, day in and day out.
Sure.
How exhausting that must be.
You guys have support group for the
Absolutely, yes.
So talk about now the caregivers a minute.
Sure. So as far as services that we have, Leslie's correct, we do have many support groups. We cover 17 counties in our chapter, and we do have one right here in Hudson that meets regularly. So they meet once a month. We're also able to provide help to the person with memory loss and the caregiver around the clock. So we have a 24-hour helpline that's 7 days a week, 365 days a year.
That's wonderful.
So if there is an issue at 3 a.m., you can call us. Someone will be there. There's master's level clinicians available all the time. And then
That's wonderful.
Yes, and
That's wonderful.
Yes, and then here at the local level, our office is right here in Hudson. We also have family service team that can follow up with families if needed. The next day, let's say if it is in the evening. So we do have that available. We're also really proud of our telephonic care consultation model, which essentially takes the person who may need a little bit more help, wants to get all the family together to get them on the same page. We would we can meet in person, we can meet over the phone. Our evidence-based program is a telephone model, so we keep in contact with a caregiver via the phone on a regular basis, which works a lot of the times a lot better.
You do with the caregiver. Oh, that's wonderful.
So they'll have one care consultant who can speak with them on a regular basis. It's a 12-month protocol. And we find it works really well for someone who may have a little bit more trouble getting out of the house. It's a lot less stressful for them, but what we're hopefully doing is providing them with tools and resources to manage dementia care better on their own. So that program is called Side by Side. And if anyone's interested in that, we'd be glad to help them there. We also have some early stage services. So if someone is early on in a diagnosis, we have a social engagement program. We have a lot of online opportunities for people to engage with other folks, to do some education, gather resources through our community resource finder as well. So if they don't want to call us, they can go to our website and do it all incognito. And but if they do need us, we're definitely here for them. And we recognize that this is not a disease that you want to do alone, that you really can't do alone. So we would encourage them to call us, and we can give a shout out to the phone number whenever you're.
Well, the listeners to this show know that there is an email address that I have set up.
Perfect.
I'll repeat it again. It is north of 60 hctv@gmail.com. If you have any questions and you want to contact Karen or a member of the Greater East Ohio Alzheimer's Association, contact me and I will be glad to give you that information.
Perfect.
I'll make sure I get it from both of them today.
Thank you.
It's scary. It makes me, I think of almost anything that could happen in my health. You know, I feel like I could tackle a lot of things, but Alzheimer's disease scares the life out of me. It really does. I'm glad there's organizations like yours. And Leslie, talk about now, tell us about your program. I just don't know enough about it. And I know that it works with seniors and others. So hit it.
Well, we, Summit County brought the Take Me Home program, the initiative in 2007, actually, to our area.
Whoa.
And it is a law enforcement only database, meaning only law enforcement has access to it. And the database is for any individual who would have trouble communicating. So dementia, early onset dementia, Alzheimer's, individuals with autism, Down syndrome, anyone that would have trouble communicating can be in the database. And what we do is we have our brochures. We send these out to schools, doctor's offices. I send them out regularly to all the schools to update people that are already in the database. And it gives you information about the program. On the back, we have our registration form.
Oh.
Now, the registration form, what's unique about our program, besides having name, address, medical information, and emergency contact information, we have information an officer should know. So this law enforcement only accessible database, I like to say that so people know that only law enforcement can get a hold of it, right? It's locked down. If your loved one is wandering, which someone with dementia sometimes wander, if your loved one is wandering and law enforcement interacts with them and they're not able to communicate their name or even just their first name, they can access the database.
So how would they?
They can, if they just give the first name, they have their secure login, they can put their first name. If not, they can go by hair color, eye color, approximate age.
No kidding.
And it'll bring up pictures. And then they can actually identify them that way.
What a wonderful program.
It is. It's a wonderful program. And I think what's pertinent to our program is the information an officer should know. So say they do identify the individual and they've contacted family, okay? They also have this information of what the pet, say someone gives you what their pet's name is. I mean, how nice is that? You can build a rapport with an individual. You know, hey, I see you have a dog named, Charlie or something. Do you know what I mean? You're building a rapport with them. Or maybe there's a buzzword or a keyword that they don't like or would set them off. That would be in there too. So it's good. It's medical information. It's good information to get them home safely. And that's the main thing.
I love that people can be identified in a myriad of ways because as I was thinking about this this week, about this meeting with you two today, I was thinking now, what if my dad couldn't even remember his name and was found wandering somewhere?
And if they're wandering or if they get lost, they probably usually are a little scared and they're not going to be able to have recall as well either. So definitely. So
who then does the application? If it was, I'm the caregiver for my father, I would do it for him.
Absolutely.
What if, does anyone ever do it for themselves?
Once I've had one person do that for themselves. And what is nice, like with our organizations working together too, I was working with a family, early onset. They registered their parent, but they were a little bit nervous to contact the Alzheimer's Association because of the stigma, but then I asked them, can I please pass their information along? And that's what I'll do. And then someone from the Alzheimer's Association can reach out to them and let them know what they have to offer, support and everything too.
And do you refer to Leslie?
Absolutely.
From your organization then?
Yes, absolutely.
Or do you recommend the family will contact her? Or?
No, we do have applications at the office,
Oh,
so
good.
we would definitely share
This is
that
a good
with families.
safeguard, for families and individuals of all ages. It's a good safeguard to know. If you know that the individual wandered, you could call 911 and say they're in the Take Me Home program, and they automatically have a picture and medical information to assist and get them home safely. So it can work both ways.
Every now and then you will read in the paper or there'll be something on the news about an elderly person wandering away from a care facility. Do care facilities also do the applications?
Yes, they do.
I would think
and
so.
I'll do presentations there as well. And we even go so far as, like, there was an individual up in Cleveland who was missing the last couple days. If they were in our county, we follow through with them and get them registered. Because we know they've already, eloped once. We know it'll probably happen again.
How many do you think you have in your program?
We have just under 2,000 individuals in Summit County.
Oh, that's huge, Leslie. That's
And
wonderful.
roughly between 250, 300 are seniors.
Oh, I think that's just excellent.
It's a
Congratulations for
safeguard.
being part of that program.
Well, thank you.
And congratulations to you. You must have a hard time sometimes, I would think, with dealing with sometimes some sad things that are occurring with the patients and their caregivers. I think the shock, maybe, that would be a surprise and hard to deal with if I knew I was.
Sure, I think you do have some of that, I think, but there's also, we have the wonderful early stage social engagement program we do. So many people are living with Alzheimer's and doing amazing things. Many people are still driving, they're still working.
Good.
They're still a very regular part of the community, and that's what our goal would be, to keep them there as long as possible. So we do get to have some fun times with some really amazing people.
Good.
I think at the end of the day, when you're talking about some of the more challenging situations that might come your way, I think at the end of the day, if you know you've made a difference and you're able to provide that care partner with some resources and tools and information to help them manage things better, or if we're able to keep someone home a lot longer by providing the education and support that we do, then that means the world. So that makes all the difference.
Interesting. Thank you so much for coming.
Thank you for the opportunity.
And again, make sure I have your contact information for both of you, so that if I get an inquiry, or if people, they can talk to you directly, but if I get an inquiry, I'll make sure that I will pass on the correct information.
Absolutely.
Wonderful.
This is
Thanks.
North of 60. Thank you so much for watching.